Hi, welcome to Behind the Scenes with Axiom Medical. I'm your host, Jason McWhinney. If you've watched this show before, thank you and welcome back. We're happy to have you. And if you've never seen the show before, this is a monthly go behind the scenes here at Axiom and to see talk to the people that make this company tick. We've officially entered our third year in this, so thank you to all the people that have watched over the past 3 years. Over the past 2 years, I guess, and all of the people that I've interviewed. It's been great. And on this episode, I'd like to welcome our Chief Medical Officer, Dr. Scott Cherry. Scott, how are you doing these days?
Doing great, Jason. Thanks for having me.
Yeah, it's a pleasure. Why don't you go ahead and introduce yourself and let the people know who exactly you are?
Sure, I'll take a stab at it. My name is Scott Cherry. I'm Axiom's Chief Medical Officer. My professional background is I'm board certified in preventive medicine and public health, and I've been with Axiom just under 5 to 6 years now.
Yeah, it's great. I remember when you came on board, and you know, for anyone that's seen any of our webinars or any of our live streams in the past, I'm sure is probably very familiar with Scott. But prior to us running a lot of webinars, you kind of sat in the background, but then something happened in March of 2020 that changed the world for us at that point in time, and that was COVID, and we kind of relied on you a lot. And in fact, I myself would visit your home quite regularly to film video with you. So I got to know you pretty well in that time. But why don't we go back to those days? You essentially became our resident expert on COVID. We sort of defaulted to you on everything. And as it was something new for a lot of people, what was that like for you? If you kind of go back and think about trying to get up to speed with everything and using your medical expertise to become our in-house expert.
Yeah, thanks for that, Jason. COVID was a very unique time for everyone. Me being in preventive medicine formally, we are trained to deal with, health threats, whether they're known or unknown. And I think what's interesting is COVID helped the specialty of like preventive medicine and occupational environmental medicine to become maybe a little bit more well known. So essentially, my credentials are what you would see in a CDC medical officer doing outbreak investigations, helping with policy or health strategy for prevention at the population health level. And so, COVID was a very challenging time for everyone on almost every level, individuals, companies, countries. And so really, there was really very little certainty early on about the medical aspects of COVID with regard to prevention, transmission, treatments, prognosis, et cetera. And what was very rewarding for me personally, and I think as a holistic approach by our company, was to be able to provide meaningful and actionable information on how to deal with COVID at every stage. And as things became better, well known, how do you apply that at the population level that's very scalable at companies that have, thousands, tens of thousands, or maybe even 100,000 employees. Really, one of the probably definitely a bullet point in my career, just personally, but it was really Axiom as a team that really made a huge difference for our clients.
Yeah, and you, along with the executive team and everyone at Axiom Medical, it was a trying time for us. We lost a bunch of people, not to the disease, not to the pandemic, but we just had to, go to a shortened workforce here at Axiom. But your expertise and your guidance and your calmness to it made things a lot easier for us internally, and I think it really made an impact for people that were watching our webinars. They're leaning on us for a lot of information, and I think, I think on behalf of everybody at Axiom, I'd like to say thank you for all of the hard work that you did. And on, personal note, thank you for putting up with me coming down to your house all the time and filming video and trying to get audio right and make sure the color's right and all that good stuff. And, making sure that your dogs don't bark too much.
Yeah.
But so let's go back. So we sort of decided, I guess, we all went home on Friday, March 13th, which was eerily funny. But after that, we sort of regrouped internally and tried to get a lot of information out, and relied a lot, like I said, on your expertise on whatnot. But let's walk back prior to that. What were you doing prior to what were you doing prior to coming to Axiom Medical?
Oh, yeah, that's interesting to think of my life before Axiom now. Um, so for a few years before joining Axiom, I was really doing corporate medicine for a large hospital system or internal to large Fortune 500 companies. So here in Houston, one of the largest health systems is Memorial Hermann. And before that, I was an internal medical director for the Dow Chemical Company. And before that, Chevron Corporation. And really, I would have to say that really most of my young adulthood was spent in the military. So I was a Navy corpsman, which is really a medic, if you're not familiar with the term corpsman. So from like age 18 to 22, I was a Navy medic. And then went back home for college and med school, and went back into the Army for uh, um, my residency, and then pay back as a medical officer in the Army. And so that really was my background before joining Axiom.
Yeah, you'd mentioned the military, and January of 2020, you and myself and a couple other people went out to New Orleans, and you spoke at an event there. And you mentioned that you're in the military, and I think you got swarmed a little bit at the happy hour after that. People were asking you a lot of questions about your military background.
Mm-hmm.
So let's talk about, what do you do outside of Axiom? I know all of us internally know that you're an avid cycler, but if you wanted to expand on that a little bit.
Sure. So really, yeah, one of my biggest hobbies now is endurance cycling. So I ride on the road. A lot of, there's a choice between riding on the road or doing mountain bike riding. So I do mostly road cycling. I love it for many aspects, actually. Uh, One, there's a great health benefit, for it, but physical health. But I actually think there's actually a lot of studies that talk about the benefits of it for the mental health aspect as well. There's a nice cycling community here in Houston where you can find different groups to ride with. Um, and so probably for the last 5 or 6 years now, I've been fairly consistent at doing cycling. And, as a physician, I love the exercise physiology component of cycling and the science behind how to train. So I really enjoy trying different training techniques and strategies to see if I can, as I age, can I keep up with the young folks and things like that. Another component I've added the last couple of years is swimming. So I do a fair amount of swimming now and weightlifting. So those are really kind of my hobbies and interests outside of work. I'm a huge dog lover. So my wife and I have had dogs for, 25 years or so. So we've had different crops of dogs or families of dogs now over the years. But those are really probably my biggest interest.
A lot of people say that dogs inherit the sort of vibe of the humans that take care of them. And your dogs, every time I went, were extremely happy and extremely warm, and
Mm,
wanted to show me their toys and wanted to hang out with us while we were filming.
yeah,
Uh, people have often told me that my dog, who's a combination Ridgeback boxer, is super mellow. I'm like, well, I'm known as super mellow as well.
yeah,
So,
yeah, I agree.
um, but you're also a bit of a gearhead as well, right? You tend to like cars. I'm not sure if that's still part of your life, but I know that
Mhm.
it was. You want to talk about that?
Sure. Yeah, just like how it's funny how you forget about your past lives, or you're like an onion with different layers. But Before Axiom, I was thinking about my previous works, which I haven't thought about in a while. But yeah, my hobbies, I grew up really loving cars. And once I became kind of a, when I was 19 or 20, I actually started working on cars. I got a second job as a mechanic's helper. And I really was super interested in mechanics and motorsports. So I got to buy classic cars and fix them up and get to make them better. And I really enjoyed that for probably 20 years or so. I still do a fair, uh, it's not as common in my day-to-day life anymore, but I still do a fair amount of mechanics in my garage, things like that. I got into road racing as well, not at like a competitive level, but just as like an amateur, just having fun out there on with track days. I think a group of us who love speed, if you're on the highways, that's the wrong place to do it. So, I would recommend anyone who has an interest in speed, search out a local track, and it's just the laws of physics that are going to limit you versus the the laws of the roads. That was quite enjoyable for many years for me. Over the years, though, I've kind of gotten away from that to a degree, just because. But I also rode motorcycles for many years, and when I used to live in West Texas or in New Mexico, one thing that I just incredibly loved was the desert and motorsports out in the desert with ATVs, dirt bikes, and then side by sides, which is now my fun of choice because it has a roll cage and a 5-point harness usually. But I love riding in the dunes and things like that. So yeah, that's been a passion of mine for a long time.
I have a friend that races in the WRL. He kind
Oh,
of goes
wow.
all over, the states to do that. They've got a couple Beamers that they do that in, and every fall, I think it's in October, at MSR, which is south of
Mhm.
Houston, which is
Yeah.
the track here. They do the 24 Hours of Lemons, which is
Yes.
yeah. I
Low
mean,
budget.
yeah, very low budget. I think you're given $500 to purchase a car, and then you're allowed to
Yeah.
modify it as much as you can. Is that something you've ever done?
I've been to MSR many, many times, but not under the 24 hours of lemons. I've had lots of friends do it. I just never got with a team. It does sound super interesting because, I think one thing that got me away from some of those activities was the expense.
Hmm.
And once you've been doing it for a number of years, it's kind of like, okay, the cost benefit is starting to go more towards just the cost. But the lemons approach is pretty interesting because yeah, you're dramatically limited to money. And I think if you can just keep your car running for 24 hours, those guys are usually the ones that win or at least place. And so yeah, it definitely is a lot of fun for me. Now I think I've again, I like to work on cars, and things like that. I just do less of it. I don't know if I think it's just a time thing where it's like I dedicate a lot of my free time to cycling and exercise, but um, really fun aspects of life in my past for sure.
Right. I want to say hi to Steve Bukowski, who's my friend who does the lemons in the WRL.
Mhm.
I don't know if he'll ever see this, but I'm going to say hi. So let's go back. It's hard to answer this question, and I always, when someone asks me what's your favorite one thing about something, I have a hard time. But give me a couple cars that you worked on throughout the years that you would be on the top echelon of your favorite cars to work
Oh,
on.
well, that's easy, because it's the cars I've had that have are really a part of me. So um, I had just gotten out of the Navy, my 4 years in the Navy, got back to Miami, and uh, I found this 1959 Chevy Apache, which is basically a truck. It's a half ton truck. It was primer gray, no AC, 4-wheel drum brakes, non-power, no power steering, and it has everyone knows of the straight axle in the rear, but it actually had a straight axle in the front. So I bought that, and that was like my daily driver for probably 5 years, all of college and maybe the first year of med school.
Wow.
I actually painted that truck in my garage, which I was renting an apartment with a garage, so they probably weren't real happy with me. But I was able to add air conditioning to it and improve the. I put four-wheel disc brakes on it, power brakes. I actually turbocharged it, so it was a rocket ship actually. But it looked like a farm truck. I put wood slats in the back of the bed, so it was a really big sleeper. So that was really one of my favorites. And then around those times too, I had gotten a really good deal on a 65 Mustang that the motor had blown, and they couldn't figure out why the motor kept blowing. So the body was in pristine shape. The interior was pristine. It was the opposite of the truck, but the motor was in parts. So I picked up, the motor just in pieces, and was able to determine there was a small freeze plug that kept pushing out, and it was losing oil pressure. I just actually put another. I don't think I did anything that was genius or brilliant. I just put another freeze plug in there, and it never had an issue for me. And the same thing, I upgraded the brakes to four-wheel disc brakes, and then I turned it more into from carbureted to fuel injection, so it warms up better, it drives better in all conditions. So those are really some of my favorite cars that I've used. I had that car for probably 10 years or so. And so I don't have any classic cars now, but in some ways I kind of am happy with that, because they kind of always need love. I mean, when I had my 59 Chevy, that was in essentially 1998, 1999, 2000. So it was already like 40 years old. Now it's like 60 years old, 65 years old. So, and now as I get older, I think about things like safety ratings. And so it's like, I won't drive a car that it doesn't have like all of the safety like maxed.
Right.
So my track car for MSR Houston was a C6 generation Corvette Z06. And I've had one of those since they first came out in like 2006, 2007. But I sold that a couple of years too, just because of the safety concerns.
Right.
Because now it's like, okay, I've made it through all of the adventures in my lives physically, with physical health and things like being in the military. So it's like, okay, let me do a risk reduction from certain things in my life. I'm not risk free, but just making different decisions.
Right. Yeah. Riding a bicycle on a
On the road
major
is
road
a
is
little bit
a
dangerous.
little
Yeah.
risky.
Yeah.
I've had in my youth, I've had four 1970s models VW camper vans, and that's pretty much like driving a bread box. So it's not necessarily very safe.
Yeah. Yeah. No, now cars are engineered or designed from creation with safety in mind. I think cars from the 50s and 60s were just designed for coolness, or just prag practicality, things like that. I don't think safety was there until maybe, I know OSHA came to exist in 1970. So there was probably this wave of safety across our cultures in the 60s and 70s. But I think cars now are really safe, which is good. That's probably one of our biggest risks out there.
But back then in the 50s and 60s, it was basically let's put some wheels on this motor and a couple chairs, and we'll set them free. Well, let's go to a couple comments here. Dare says, "Thank you, Cherry. Great leadership in the face of adversity." Talking about COVID there. And Michelle Specht, Dr. Cherry was instrumental to all of us on the on-site operations during COVID. Your proactive leadership and guidance, constantly evolving months and years. So everyone says thank you for that. Lauren says, so great learning a bit more about Dr. Cherry on all his fun hobbies. And Holly says, hi, Jason and Scott. Hi, everybody.
Good to see everybody.
Yeah. So let's go into the future. We've established what you like and what you're currently doing, but anything planned for the future? Any vacations? I know with you work a lot. You're very quiet behind the scenes as far as we are concerned, but we know that you do a lot. But anything to unwind? Any of your favorite hobbies to do something like that besides cycling? Is there anything else
Mhm.
outside of that?
My wife loves to travel, and there was a period of time when I didn't really like to travel much. I'm starting to be open to it more again. So it's just kind of doing some travel um, here or there. It's probably to be determined at times where, but that's become more of an interest. Um, but really, I kind of outside of maybe a big trip every once in a while, my day to day is kind of my routine and my interest. I'm trying to think if I do have anything planned otherwise. Not really. That's probably going to be the low point of this video, but maybe something will hit me before we close out.
No worries.
Mhm.
Before we finish up, I want to jump back into, ask you, what was it that got you into medicine in the first place?
Yeah, um, I'm not sure how folks get into their specific occupations. It's probably a mix of a bunch of reasons. I wasn't one of the kids who knew he was going to be a doctor from an early age. I actually probably thought I was going to be more like an engineer. I really liked math and science, and um, I thought actually I was probably going to just go into some type of engineering degree. Um, but what really dramatically changed my life from an occupational perspective, and really probably my whole life in general, was joining the military at 17 and becoming a medic. It was really my experience as a medic working for other senior medics, other nurses and doctors, and they encouraged me to, progress in the medical field, which I had never really been exposed to. No one was really a physician in my family or external network. If you have a network as a teenager. And so it was really a very like slow and deliberate. Okay, I've now worked in healthcare for 4 years. I've been encouraged by other physicians and nurses to do it. Let me see if I can just get through college and get into med school. So it was a slow, deliberate process. It wasn't something that was like, oh, at age 5 or age 10, I'm kind of wearing a white coat and you know pretending to be a doc. So it was kind of late in life, and it was a slow deliberation.
Right.
But for me, I think what draws me to it is also the limitations of it. Is it is science based, but it's an applied science. So you have to be very strong in the science, but applied science is essentially taking what is known but applying it to an uncertain or relatively chaotic system, whether it's your patient or a population of people. And so that's the beauty of it, but that's the challenge of it.
That's great. Usually at this point, I ask people, any closing remarks, any words of wisdom you want to share with people, but I'm going to try a different approach.
Hmm.
If you could, what's some advice you could give yourself back in, say, February 2020?
Oh. Well, this is gonna. I think I'm only gonna laugh at it, which I've already laughed at it. But it's almost kind of what I said earlier, but taken to like the nth degree, or taking it very extreme. So um, again, I was already like a preventive medicine physician for over 10 years before COVID hit, but because the stakes were so high for COVID and the uncertainty was so high, it really pushed me to um, it pushed me to my limits to be able to communicate to our external stakeholders our value, still within the realm of the limitations of what we know, but also conveying that we're always going to be on the right side of protecting their employee populations. Um, and so I think one of the things that pushed me was that really trying to convey, I think one of my strengths is conveying to a person, a patient in front of me, or even to like a corporate leader, being able to speak in layman's terms. But when you're talking about something like COVID that is really so novel and not well established, the medical aspects of it with regard to diagnosis, prognosis, treatment, et cetera, you really have to dive into statistics. So I spent a lot of time doing that, as things were unfolding. But it was very challenging. Again, we've really never seen something like this at that scale, in my lifetime at least. So I don't know if the audience can resonate with that, but I guess I would just share that since you asked it specifically. Yeah.
That's fantastic. So, I mentioned earlier, I said on behalf of the entire company, thank you for everything that you did, but especially on the marketing team, we're always asking you to join our webinars and share your experience and expertise on that. And so I know I definitely speak for all the marketing team. Thank you for all that you do. I've been talking with Dr. Scott Cherry, our Chief Medical Officer. Anything you want to say before we drop off?
Well, maybe I will turn the tides on you and say thank you also for all your assistance with the marketing and communication efforts, as well as to the whole marketing team. Axiom is the first company that I've worked at where I'm not necessarily an internal resource for all of the stakeholders. So essentially, we are an outsourced company for all of our clients. And so this is the first time where I've seen the power and necessity of a marketing department to communicate our value proposition to our current clients as well as potential future clients. And so, doctors are notoriously bad at being business minded, and so obviously I'm not going to ever be there, but I really appreciate what marketing has done for Axiom in the sense of communicating, my expertise, as you said it, during COVID, and now just our core values and core services for COVID. But again, I think marketing is really a critical need that as a physician before coming to Axiom, I just didn't know much about marketing. So I really appreciate the whole marketing team.
Well, thank you very much, sir. I appreciate that. Thanks again, everybody, for watching, and we'll see you next month.